In this training, you will learn why a safe sleep environment for your baby is so important. We'll also discuss how you can create a safe sleep environment. This topic requires that we talk about the sad reality of certain causes of infant death. While this isn't a pleasant topic, it is important. When you know what the risks are, you can learn how to avoid them and how to create a safer place for your baby to sleep. This training focuses on preventable causes of death related to baby's sleep environment because research shows if we follow certain practices, babies are less likely to die during their first year of life. The goal is not to scare you or to make you worry, but to provide you with specific techniques and knowledge so your baby can sleep as safely as possible. Let's get started. According to the Center for Disease Control and Prevention, there are about 3,500 sleep-related infant deaths each year in the United States. And the Oregon Health Authority reports an average of 40 babies dying each year in Oregon due to unsafe sleep environments. There are several known sleep-related causes of infant death, and they have to do with how or where a baby sleeps. These can include accidental injuries such as suffocation, which is when something such as a pillow or a person covers the baby's face and nose, blocking baby's ability to breathe. Entrapment, which is when the baby gets trapped between two objects like a mattress and a wall and can't breathe. And strangulation, which is when something presses on or wraps around the baby's neck, blocking the baby's airway. There are also cases where the reason for a baby's sudden, unexpected death remains unknown. You may have heard the term SIDS. It stands for Sudden Infant Death Syndrome. SIDS is defined as the sudden and unexpected death with no known cause, even after a full investigation, of a baby under 1 year of age. About half of the sudden, unexpected infant deaths that occur in the United States get categorized as SIDS. In the United States, SIDS is the leading cause of death during baby's first year, with most SIDS deaths occurring when baby is 1 to 4 months old. In the 1990s, new recommendations were introduced encouraging people to put their babies to sleep on their backs. A public awareness campaign was launched, and since that time, back sleeping has started to catch on. In fact, the number of babies placed on their backs to sleep has tripled. And the SIDS rate in the United States has dropped by 50%. So while there is no known way to prevent SIDS 100% of the time, research shows parents and caregivers can take steps to reduce the chances of SIDS and accidental injuries from happening in their families. So now let's talk about how we can create a safe sleep environment for babies. Here is one example of a safe sleep environment. The infant sleep area has no crib bumpers or pillows, blankets, or toys. Baby has his own sleeping area, but it's located in the same room where a parent sleeps. Let's go through each characteristic of a safe sleep environment. First, always place baby on his or her back to sleep. The back sleep position is the safest position for all babies until they are 1 year old. Babies who are used to sleeping on their backs, but who are then placed to sleep on their stomachs, like for a nap, are at very high risk for SIDS. You may have heard that babies should be put on their tummies for sleep in case they spit up or vomit. There was a time when this was the common thought, but research now shows that babies are safer placed on their backs, and a close look at a baby's anatomy actually shows us why. The trachea is the tube to the lungs. The esophagus is the tube to the stomach. Notice that when baby is asleep on her back, the trachea is located above the esophagus. Healthy babies naturally swallow or cough up fluids. It's a reflex people have. Babies may actually clear these fluids better when they're sleeping on their backs because of the location of the opening to the lungs in relation to the opening to the stomach. Since back sleeping recommendations have been in effect, there has been no increase in choking or similar problems for babies who are put to sleep on their backs. While back sleeping is very important to prevent sleep-related deaths, babies do still need to spend some time on their tummies. According to the Mayo Clinic, tummy time is best when they are awake and supervised. Tummy time helps babies develop stronger neck muscles and increase motor skills. Tummy time is great, just not at sleep time. The second characteristic of a safe sleep environment is having a firm, flat surface, such as a mattress covered with a fitted sheet that is snugly fit inside of a crib, a bassinet, or a play yard. Soft surfaces like water beds, adult mattresses, fluffy comforters, and pillows are associated with a higher risk of infant death. Be sure that cribs, bassinets, and play yards follow the standards set by the United States Consumer Product Safety Commission. For example, crib slats should be no wider than 2 3/8 inches wide, which happens to be about the width of a 12-ounce can of soda. There should be no missing slats or broken hardware. Third, do not put soft objects, toys, crib bumpers, or pillows inside baby's sleep area. Keeping these items out of the area reduces the risk of SIDS and accidental injury. Crib bumpers have been used in the past because people wanted to prevent babies from bumping against the wooden slats of a crib. But evidence shows us that crib bumpers are linked to serious injuries and death. Therefore, they are not recommended. Keeping these and other soft objects out of baby's sleep area is the best way to avoid these dangers. We also recommend not placing loose blankets on or under baby. Many people know that swaddling can be an effective comfort measure for fussy babies. That leads us to the question about whether swaddling is safe for baby's sleep environment. Here's what you should know so you can make the best choice for your baby. If you decide to swaddle your baby for sleep times, always place baby fully on the back to sleep, and stop swaddling baby for sleep once your baby starts trying to roll over. If a baby is swaddled and then placed on the stomach for sleep, there is a higher chance of SIDS and accidental death. If baby is capable of rolling from the back position onto the stomach while asleep and swaddled, there is a higher risk of death as well. Next, do not let your baby get too hot during sleep. Dress baby appropriately for the environment and do not overbundle. Parents and caregivers should watch for signs of overheating, such as sweating or the baby's chest feeling hot to the touch. Keep the baby's face and head uncovered during sleep. Research links increased SIDS risk with too many layers of clothing or blankets, and with higher room temperature. Dress your baby in sleep clothing, such as a wearable blanket, designed to keep him or her warm without the need for loose blankets in the sleep area. Next, sharing your room with baby is a good idea. Keep baby in your room close to your bed, but on a separate sleep surface designed specifically for infants. Ideally, baby should sleep there for about a year, but at least for the first 6 months, because room sharing reduces the risk of SIDS. Like shown here, a separate sleep surface for baby right next to your bed reduces the risk of SIDS and the chance of accidental injury. Baby should not sleep in an adult bed, on a couch, or on a chair, whether it's alone, with you, or with anyone else, including siblings or pets. Bed sharing increases the risk of SIDS. If other children are in the bed as well, the risk of SIDS is 5 times higher. Babies younger than 4 months, or those born prematurely, are especially at high risk for accidental injury when bed sharing. To reduce both SIDS and accidents, avoid smoking, drinking alcohol, and using marijuana and illegal drugs during pregnancy and after baby is born. Don't allow smoking around your baby. Secondhand smoke causes numerous health problems in infants and children, including more frequent and severe asthma attacks, respiratory infections, ear infections, and SIDS. Breastfeeding has many health benefits for mother and baby. Babies who breastfeed or are fed breast milk are at lower risk for SIDS than babies who were never fed breast milk. And the longer a baby is exclusively breastfed or fed breast milk, the lower the risk. If you do bring baby temporarily into your bed for feeding or comforting, be sure and put the baby back into the separate sleep area as soon as you are finished, especially before you fall asleep. If you fall asleep while feeding or comforting your baby in an adult bed, place him or her back in the separate sleep area as soon as you wake up. Evidence shows that the longer a parent and an infant bed share, the higher the risk for sleep-related causes of infant death. Let's review what we've learned so far. Putting baby to sleep on the back is best. Use a firm sleep surface specifically designed for a baby. Don't allow extra items in the sleep area with baby. While sharing your room is a good idea, it's not a good idea to share your bed. Don't let baby overheat by overbundling. Always avoid smoking, alcohol, and drugs. And finally, breast milk provides extra protections. Remember, safe sleep practices reduce a baby's risk of sudden, unexpected death. This information was brought to you by Trends on Thriving, a collaborative work group aiming to reduce the rate of infant mortality in Klamath County, Oregon.